I'm going to try today to talk a little bit about lab work and why we do lab work and what's involved with it. Lab work is a very key tool that we use in front of disease situations or in pre-preparation for anesthesia. And the reason we do lab work is not only to find out what's going on with the individual or potentially going on with the individual, we want to make sure that there are no issues going into surgery. The basics that we use in lab work are also varied. We also check stools, we check blood work, and we check urine. Those are the primary things that we do in the clinic. In the blood work itself, we do complete blood count, where we look at white blood cells, red blood cells. We're looking for infections and we're looking for anemia, and those would be the primary problems. Also clotting defects such as decreased platelets and platelet counts. When we're looking at chemistries, we're looking at a number of different chemistries that can, on the basic screens, looking for what's the liver situation doing. Are we having liver problems? How are the kidneys doing? Are we having kidney problems where the dogs drink lots of fluids and urinate a lot? Lower urinary tract problems such as cystitis or bladder infections. We test urine, very simple tests that can be done to look for urinary tract infections. The basics that we do use in the clinic are just a few tools, and we have them shown here today. Just to kind of start out to point out, first off, is stool samples. A lot of people worry about worms and parasites in their dogs and their cats. So we begin with a sample that's collected either by our staff or by the owners at home. And it's just a simple collection tool that brings in a sample of feces so that we can run the test. And the test, basically, the stool sample is put into a little container like this, and it's got a very dense salt solution in there. What happens then is that it's timed for like 12 minutes. And in that time period, the eggs float out of the solution that is where the feces has been dissolved in, and those eggs will float up to the top surface of this particular container. At that point in time, at the end of 12 minutes, we'll actually use a small little glass cover slip, and that glass cover slip will go on top of the slide. Slide is then put underneath a microscope, and we'll actually physically look for the eggs. The challenge we have in today's testing program is that we're looking physically for the eggs. If the females of the parasites are not laying eggs or they're not in their egg-laying cycle, we will not find the eggs. And that's another primary reason for us to do follow-ups on these individuals. We're lucky enough these days and times also to have, with our flea and tick prevention along with our heartworm prevention combinations, we've got good control over many of the intestinal parasites.